Good morning, good afternoon, good evening, and good night, friends and colleagues from across the world. Today we are back in Europe, our final day of the 2020 Peer-to-Peer Global Dental Interdisciplinary Summit, day 45. We're going to conclude this day with 4 action-packed webinars back-to-back in the next 5 hours. Our first guest, the most famous and well-respected dentist of the island, representing Britain and Ireland, currently actually in Ireland. Good morning, Dr. Lynch. How are you?
Good morning. I'm very well, thank you.
Thank you for joining us. With that said, I would like to give you the official introduction so people have an idea of what you have done for our industry. Professor Dr. Edward Lynch is a professor in the USA in the University of Nevada, as well as a professor in England. He became the principal director of biomedical and clinical research in the University of Las Vegas in 2016. He completed a full term as head of dentistry from 2010 at the prestigious University of Warwick. He held the position of professor of restorative dentistry and gerodontology of the Queen's University Belfast. He was listed as one of the world's top 100 doctors in dentistry, has been elected the most influential person in UK dentistry by his peers, and was awarded a United Kingdom as well as the World Lifetime Achievement Awards in dentistry. Very impressive, doctor. Here, it gets better, guys, if it's not enough. He's the editor of numerous international dental journals, editor of boards of more than 20 international journals, including the prestigious journal Nature Scientific Reports. More than 700 peer-reviewed publications with almost 700 citations, as well as many more publications in non-reference journals. He has supervised more than 50 master's and PhD students and have been awarded numerous world first prizes for his research. He's an extremely talented, skilled clinician and a specialist in 3 disciplines: endo, prosthodontics, and restorative dentistry, as well as being a BUPA consultant in oral surgery. My goodness, Doc, you have one of the most impressive credentials I've seen. He's an extremely talented clinician. He just completed a new textbook on management of medical emergencies with Dr. Chet Trivedi. And he hopes to have his book save many, many lives. Very noble. And it gets better. He donated all the royalties from this book to a charity to support conservation of tigers in India. He's also been elected as the liveryman in the City of London, and also been awarded the honor of being a free man of the City of London. City of London, wonderful. You're very active in many charities, and you have donated and raised considerable funds for numerous charities. One question for you, Dr. Lynch. What gives you the motivation to lead such an exemplary life?
I'm just lucky that I only do my hobby. I don't work at all.
That's right. When you love what you do, it's a hobby, isn't it?
Absolutely. One day I might look for a job.
Well, we are very honored to have you. A lot of people look up to you. A lot of people would love to have the career that you have had. I personally don't know how you did it in the 4 or 5 decades that you've been at it, but when you took the time, but the accomplishments are staggering. I've known you from New York, our annual dinner meetings when you come, and you have the International Academy of Dental Facial Aesthetic meetings, and you're always wherever you are, one of the, if not the most important person in the room. With that said, Doctor, I'd like to give you the floor and begin your presentation.
Well, I would like to very much thank you for this opportunity and for allowing me and asking me to present. So thank you very much for inviting me.
It's our great life's honor. So Dr. Lynch, I'm going to go ahead and open your presentation. If you would like to go ahead and go full screen, we can get started.
Well, thank you ever so much, and thank you very much to everyone. Good morning, good afternoon, good evening, bonsoir, Fulcher to all those listening. Today's presentation is related to the management of deep, almost cariously exposed lesions using ozone. And I will mention my two colleagues who are instrumental within this project, Professor Mahmoud Alomiri, who did his PhD with us in Queen's University Belfast, and Andrzej Kielbasa, who you will know as the associate editor of Quintessence International and based in Austria. But first, I would like to tell you a small amount about the place where I'm staying now, which is Skull Village in West Cork in Ireland. That's this beautiful harbour. The sailing is magnificent. The Fastnet Rock lighthouse, you can probably see over my shoulder outside, where the famous Fastnet race is held every year and people sail around this rock. Superb beaches. And these beaches are beside the water, which is warm as the Gulf Stream comes into this area. And as a result, we don't get frost, we don't get snow. It's always nice and warm. And Castle Head, where there's 3 castles on the top of this mountain right beside Skull. Down the road is Kilcoe Castle, where Jeremy Irons, the actor, lives with his wife, one of the Cusacks, who are the most famous acting family in the world. And obviously wonderful drives all around the Beara Peninsula beside Skull as well. So beautiful scenery, well worth a visit. Please come to Skull and West Cork in Ireland, where you will thoroughly enjoy this stunning landscape and have a very nice time. And we'll be running various courses on ozone and various other aspects here in this area in Skull. And I'll give you my email address at the end for those who would like to come, and we can organize accommodation for you here in Skull. And obviously there's Kjol August Crack in all the local pubs in the evening. So back to today's presentation, where dentistry has obviously changed from the old days, and we are now much more minimally invasive. If we take, for example, this lesion in the distal of this second molar, in the old days, dentists would actually aim to remove most of that infected carious dentine and place a restoration, but unfortunately, many of those teeth required root canal therapy. Today's technologies with biomimetic dentistry allows a dramatically different approach to these lesions, and Raymond van Dijken and others have led the world in this for many, many decades now, and it's a different form of dentistry. If we examine the distal surface of this lower right first molar tooth, and once again see the carious lesion once again with significant symptoms extending towards and very close to the pulp horn, to manage that in a very biomimetic way instead of the old, more traditional way, whereby often root canal therapy would have been required. Another lesion virtually extending into the pulp in this second molar, again managed in a biomimetic way. Same principle, simple, conservative, minimally invasive, and better for the patient. This is not my slide. It came from a dentist in South Africa. We can see a very extensive carious lesion in this child's tooth, extending into the pulp, and once again managed in a very conservative biomimetic way using the Helizone and biomimetic glass ionomer cement restoration. So it's a different type of dentistry. Professor Ray Bertolotti's case, where he's using CBCT in San Francisco in the USA, using Helizone and again a glass ionomer cement, and showing the mineralization which occurs over this time period, a biomimetic approach to an old problem. Another case I've treated again with Helizone, leaving the deep caries in a very symptomatic tooth. In this case, it was a study, so we temporized for a period and reopened and found after removing only the temporary restoration, it was rock solid. It had remineralized, and where would I have been had I extended the extra 2 millimeters by the traditional method? Professor Jeff Knight in Australia, this is one of his cases where once again leaving extensive caries, treating with Helizone in Australia by Professor Jeff Knight, glass ionomer cement restoration, and then showing once again the lesion almost extending into the pulp, a follow-up period where there's still radiolucency, and over time this radiolucency dramatically reduced with the biomimetic restoration and the patient clearly not needing a root canal therapy. So this leads us very clearly to our today's presentation, where we have two options. We have the old traditional method of removing all of the caries with an amputation type approach and a restoration, which often, as we know, can require root canal therapy subsequently and more costly for the patient. Or we can try a more conservative approach where we aim to kill the microorganisms and allow the tissue to heal, and use agents that can remineralize that carious tissue and assist that healing in a biomimetic approach. Ozone is clearly proven to kill microorganisms and kill these microorganisms better than any other method available. So ozone conservative treatment of these deep carious lesions may well assist a less invasive management strategy. So therefore, the aim of this study was to assess the pain score and the need for root canal therapy after either traditional caries removal and restoration, or after a more conservative management of deep caries lesions, ozone, and then the restoration. Methods: after ethics committee approval, 56 patients, all with pain, with a mean age of 23, almost 24 years old, consented to be randomly allocated to receive either the traditional method or the more conservative method with ozone. The ozone method differed from the traditional method by leaving the deep leathery caries on the pulpal floor and treating this with 10 seconds of ozone from the Helizone machine from Curazone in Germany. This is what the Curazone X4 machine looks like, which was used in this study. And it's simply used by delivering the ozone in a completely safe manner directly into the lesion. In fact, it can deliver up to 9,000 parts per million of ozone at a flow rate of over 600 cc's per minute. So it's an enormous dose of ozone delivered. Very neat, very simple, and easy to use. A conventional glass ionomer cement, which was Riva self-cure high viscosity from SDI in Australia, was placed followed by a composite resin in each cavity. The pain score was recorded before treatment and after 24 hours, and then at the months of 3, 6, 9, 12, 18, and 24. Results. The pain score for traditional treatment was 8.07 before treatment and 5.5 after 24 hours in the traditional treatment group. Whilst with the ozone group, it was a fairly similar pain score to start with, but a dramatically reduced pain score subsequently, where it was almost no pain whatsoever. And this was highly statistically significant. At 3 months, 8 of the subjects who had required root canal therapy in the traditional managed group where no ozone was used, and no subject required root canal therapy in the group where the conservative approach was used, followed by ozone. There were no further changes up to 24 months, and once again, this result was highly statistically significant. So why do we get this result? What's the rationale as possible hypotheses and explanations as to why this has occurred? Well, firstly, ozone is the most powerful antimicrobial agent we could ever use in dentistry, and there are numerous papers to actually prove this. Ozone also reduces cariogenic microorganisms that causes dental caries. And a vast range of papers, I haven't even updated it since 2018, have been published in the literature showing this significant reduction of cariogenic microorganisms subsequent to ozone treatment. There are many of these papers showing 99% microbial killing after ozone treatment. And this is from the PhD thesis of Eileen Bison in the University of London, and she's currently a reader there in Queen Mary's Dental School, University of London. And this has been repeated by a number of Swedish dental schools, this one by Professor Jan van Dijken's team, again showing dramatic, significant effects of the helizon on these cariogenic microflora. Another study by Professor Peter Lindstrom and team in Gothenburg Dental School in Sweden, once again showing dramatic effects of the helizon treatment on these cariogenic microorganisms. Professor Jeff Knight and his team in Australia have shown, as they're linked to Adelaide Dental School, have shown the inability to form a biofilm on surfaces after treatment with helizon. So there's clearly quite a number of mechanisms with respect to the antimicrobial effect. Professor Martin Grootveld and team has shown very clearly from De Montfort University in Leicester in England the other biomolecular effects of ozone and the significant effects of what this does with consuming organic molecules and organic acids, and thereby making the whole process less caries active. Another mechanism is that ozone is the most powerful oxidant we can actually use. And this is again shown by quite a number of studies. And if we can avoid using dramatic high concentrations of hydrogen peroxide, there are benefits for patients, because clearly hydrogen peroxide on its own at high doses does have a number of undesirable and adverse effects. And if we're using ozone with it, we would need considerably less due to this high oxidant ability. And quite a number of studies have shown how powerful the helizon is with combining with hydrogen peroxide to whiten teeth. Here's one again with my colleagues, Professor Alamiri and Professor Kielbasa, which we published in the Nature Journal with Scientific Reports, which is a very good high impact factor journal. We've also published other papers on this topic, this one in Quintessence International in 2017, another one in the Journal of Dentistry in October 2016, another one in the Journal of Dentistry in March 2016. And I know you can view this presentation afterwards, so you can document any references from looking at this presentation in your leisure. Another one we published in the American Journal of Dentistry in 2016. And another one in Quintessence in 2018. Another mechanism is from this excellent group from Munich Dental School in Germany, where Professor Huth and Professor Reinhard Hickel, who's the dean of that school, have shown that ozone has dramatic effects on the nuclear factor kappa B system, which then has other effects on anti-inflammatory mechanisms and therefore could help the pulp to heal. Another mechanism relates to its biocompatibility, and this was a very classic study where they've proven the antimicrobial effectiveness as well as the biocompatibility of using gaseous ozone in vivo on incomplete caries removal on teeth that were subsequently extracted, and then showing all the beneficial biomolecular mechanisms which occurred in the pulp as a result of using ozone and reflecting its biocompatibility. Again, another study reflecting this healing property is this European Journal of Pediatric Dentistry paper, where they presented a new method using the helizon to treat very deep carious lesions in primary teeth, and found that it had a success rate of around 94%. Which can be significantly better than a number of the studies doing pulposities on these teeth. thereby allowing the treatment of children to be more conservative and more minimally invasive. Again, another study reflecting the healing properties of ozone, again published in scientific reports by Professor Alamiri and team. And this is another excellent study reflecting how ozone can help these lesions heal faster and also have significantly less pain. Again, another mechanism whereby the ozone can affect the odontoblast cell line in the pulp. And this is from a group of excellent Japanese professors in a very good journal, in the Journal of Endodontics. Some people suggest we can just seal in caries. But unfortunately, there are some studies which show if you seal in infected caries, these can progress, as shown by this study from these Scandinavians in the journal Caries Research. Another study by another excellent group of European researchers once again showed that under sealed restorations, caries also progressed. Another study by Simon MacDonald and Professor Aubrey Scheim showing again progression of caries under sealed restorations. And again, Professor Mike Swain from Dunedin in New Zealand, again reflecting the fact if you leave lots of infected dentine, we will not get significant mineralization. So back on that last point, there are a number of studies which do show that you can get success without killing the microorganisms, but there are other studies which show it is better to kill the microorganisms because they would otherwise progress and lead to the patients having problems. Another mechanism involved in the results of this study is the bioactive glass that was present in the glass ionomer used from Riva, from SDI, which has considerable amounts of strontium and therefore assists mineralization. And this was led by Professor Robert Hill's team from Queen Mary, who really are the world leaders in bioactive glasses. Another mechanism is the strontium is replacing calcium, again from this bioactive glass ionomer, conventional glass ionomer, Riva, which was used in this study. Ozone also kills the acidogenic microorganisms, altering the pH, which can also assist mineralization. Ozone degrades polysaccharides, which helps break up the biofilm. And the commensal non-pathogenic microorganisms prefer this oxidative stress and therefore may be assisted by the ozone. Ozone can degrade the antibacterial peptides, which Mutans uses to kill off the commensals, again, giving a mechanism as to how ozone is working. And we know from a variety of studies, as again from Eileen Bison's PhD study, showing a 99% reduction in microorganisms from lesions taken in the mouth 5.5 months after treatment with ozone. And there are many studies, again, showing effectiveness and significant effects of ozone, Helozone, on carious lesions. So before we conclude, just to summarize that last group, there are numerous mechanisms, and I'm sure I'm only touching on some of them, which gives the rationale as to why ozone is effective in dealing with these deep carious lesions, which are symptomatic. And therefore, the conclusion of this study is that ozone treatment of symptomatic, deep, almost cariously exposed lesions assists a more conservative approach to treating these extensive caries lesions, as well as being associated with less postoperative sensitivity and less need for root canal therapy. The end aspect of that is that this allows dentists to be more conservative, to have less drilling to have to do for patients, to retain more tooth structure, and by using this technique, to allow the tooth to heal itself. the fact that these patients will then need less root canal therapy and have less extensive restorations, not alone saves potential discomfort and time, but also saves the patients a considerable amount of money. So it is something that is worthwhile having within our group of methods we can use in our daily practice. I notice I've still got considerable time left, so although I've finished the study, I would like to present some more clinical aspects. And just to mention, here's an unfortunate patient who presented to one of my consultant clinics in hospitals. And this was a 16-year-old girl with bulimia. And basically, she has a number of teeth which are considerably eroded, acid erosion from her bulimia. And we can see that not alone has she got considerable bulimia on these teeth, but we can also see they are virtually into secondary dentin. Once again, with the treatment of these, the ozone treatment on the pulp, by the mechanisms we described earlier, can also assist this healing. So prior to restoration, it is worth doing these anti-inflammatory healing mechanisms on the pulpal tissue by treating with ozone first. An excellent research has been published by Professor Vilio Bocchi in Italy, showing the effects of ozone on blood, where it releases endogenous interferon, releases beneficial cytokines, reduces inflammation, raises antioxidant mechanisms, and overall, basically helping the pulp to heal. This case was actually carried out by one of our undergraduate students in Queen's University, Belfast, Gemma Taylor. And I think Gemma did an excellent job on this patient. And this was the patient many, many years afterwards on a recall. And still, she was very happy with the end result of her treatment, which was done as an interim measure by an undergraduate student. And I think the student should have been congratulated on the very good result. So well done, Gemma, for managing this patient in this way. One might ask, does ozone affect the bond strength? And there are many studies, not just ours, but by many others, who've shown that ozone does not significantly affect the bond strength in any detrimental way. And in fact, a number of the studies have shown a trend to better bond strengths with adhesives and composite resins subsequent to ozone use. Again, this is not just for adult teeth. It's also applicable for deciduous teeth. And here was a paper presented by Professor Adrian Lucy, who is an excellent researcher and in fact currently the Dean of the dental school in Bern Dental School in Switzerland, and also a professor of pediatric dentistry, and showing how this can lead to lesions and a management of these anxious children using the Helizon. These are cases from a dentist in Wales, Chris Dalton, an excellent dentist. And these are his patients and his practice, whereby he treats these lesions. You can see that second premolar with a fractured distal, and most probably early pulpal involvement. And what Chris has been doing for decades with his Helizon is managing these lesions, ozone treating all of that periphery, and then placing his glass ionomer cement into those cavities in a biomimetic way. That's his happy patient after treatment. That's his Helizon. There's another patient. You can once again see the very extensive caries lesion distally on that lower left tooth. See the lesion. He opens up to get access. He then delivers his ozone. He once again restores with his, in this case, his Riva. And once again, another little happy Welsh little girl, very happy with the end result. Of course, There are almost 100,000 dentists around the world with ozone machines. And in the study, I mentioned the Helizone X4 from Germany. This is actually the earlier version, which is another version of the Helizone. But this machine will also work, and in the studies has been shown to have a number of the studies presented were actually using this machine. So it also can deliver thousands of parts per million into these lesions on a very predictable basis. So it doesn't have to be the new machine, it could be using your old machine. And I must state that literally I have had patents for these devices, which were through the universities, and the universities received fundings for grants and were granted the IP to the company. I personally do not get any funds or payment or royalties of any kind, and nor have I received any royalties, etc., from these machines, as I've worked for these universities. And nothing in this presentation am I paid any fee for in any way by any company. Professor Bocchi and Professor Philippi have also presented numerous studies, and this is an example of some of the conclusions they've had from their studies using ozone. We can see how the beneficial effects occur of tissues receiving more oxygen, increasing phagocytic activity, increasing the activity of fibroblasts, increasing collagen synthesis, increasing cell proliferation, increasing chemotaxis of monocytes and fibroblasts, and so on. Numerous effects which can assist healing. With all techniques, it's important to question, are what we are doing safe? Because ozone itself is damaging to lungs if we inhale it. So if you were to inhale considerable amounts of ozone, it would cause considerable lung damage. So studies have assessed this and have been published in good peer-reviewed journals. This is again from a group in Umeå Dental School in Sweden with Professor Jan van Dijken's team again. And what they did was they used the Helizone from this device and measured the amount of ozone that could be released in even using it the wrong way. Their conclusion was, with the Helizone, it is completely safe to use because the Helizone only produces ozone when it is perfectly sealed. You cannot produce ozone into the patient's mouth without the seal. There are other devices on the market that blow out ozone, and for those type of devices, they would not pass that test. This was examined by Professor Brian Miller and Dr. Hudson in King's College Dental School in the University of London and published in the Journal of Dentistry. And what they showed was that the Helizone, their conclusion was the Helizone was completely safe, but the device to blow out ozone was not safe. So this safety is again linked to the fact of the healing properties and blocking this nuclear factor kappa B system in this Journal of Dental Research paper. But in addition, we can see that this excellent group, Professor Huth and Professor Hickel and team from the University of Munich Dental School in Germany have also looked at the effect of ozone on oral cells and compared it to other antimicrobial agents. One finding from this study was that ozonated water is totally biocompatible to human oral cells, even monolayers of these cells, whilst other established antimicrobials, chlorhexidine and sodium hypochlorite and hydrogen peroxide and many others, are highly irritant and cytotoxic and actually kill human oral cells. And this was published in the European Journal of Oral Sciences, thereby once again reflecting the biocompatibility of ozone, which is highly active against microorganisms, but not irritant to human cells, as shown by this ozonated water study. Professor Philippi once again showed the wound healing, how it improves healing subsequent to ozone. And all of this fits perfectly well into what we have presented on today's presentation. Another aspect which is not part of today's presentation, but is used by many dentists worldwide, in the United Kingdom, Revis Star from SDI, which again, I'm not receiving any royalties or anything, any form funds from them for this presentation or otherwise, contains silver diamine fluoride. And SDF is very effective at helping to kill microorganisms within caries. And they have a method, a patented process within their product, which adds on potassium iodide, which dramatically reduces subsequent staining, which can be associated with the use of SDF. It's a simple method to use. Use it, paint on the contents from the silver capsule first with the silver fluoride, and then subsequently you paint on the potassium iodide into the caries lesions. And there are many dentists who are using this technique and combining this technique with ozone and finding a synergistic effect. And this is something we plan to do a study on to assess the synergistic potential effect between Revis Star, silver diamine fluoride, and ozone. I should have also mentioned the study which I presented today has not been funded externally by any source. We have also examined these. Some people will say, why not just use regular fluoride? We carried out a systematic review and meta-analysis, which we published in this journal, once again, this high-impact journal of Scientific Reports. And we looked at silver diamine fluoride versus sodium fluoride for arresting dental caries in children. And we found that the silver diamine fluoride was significantly better than just using fluoride. So this is, I believe, something which, again, every dental practice, I believe, should have within its armamentarium for use to help patients in a biomimetic and a conservative way and a minimally invasive way. So finishing from our minimally invasive way, which I believe is the direction dentistry is clearly going, whereby we are going to be able to help patients in a more conservative way, less destructive way, faster way, more efficient way, and less costly. And as we could see from the study we presented today, it ends up with having less deleterious side effects. So clearly, I believe this is a win-win-win scenario. We're going to be running hands-on courses on ozone and SDF and many other techniques and adhesive dentistry here in Schull, in Ireland, in West Cork. And there are many places where you can stay. You can more than welcome to, we can organize your accommodation for your attending these courses. I'll give you my email on the end. Here is one place that's you can also stay on during your trip. It's it's actually not very far away. It's Adair Manor, which in fact, I think last year was ranked the best hotel in the world. This is Ashford Castle, which you would enjoy. These are in the west, all in the west of Ireland, which you can enjoy on your trip to Ireland. Ashford Castle, I think, was ranked the best hotel in the world about 4 years ago. It's a place whereby you probably meet more Hollywood stars than you'll meet in Hollywood. It's where the US presidents come. It's where the world's #1 golfers come. It's an absolutely wonderful place. The part on the left was actually built in 1023. Almost 1,000 years ago. This was also for a period the home of the Guinness family, and you will know a very famous drink which they produced and still produce. So castles are very plentiful. There's another castle in the west of Ireland. In fact, the wall on the left of the castle is where the Beatles took their cover photo album on, where they sat on that wall for their album. And these are wonderful, very comfortable places to stay, very enjoyable, excellent golf courses and beaches, beautiful scenery. And I think you're going to thoroughly enjoy your time coming to the west of Ireland. Of course, coming for a dentistry course. But there are many things I think you will enjoy about this stunning, beautiful part of the world, and can base yourself here nicely in Skull. The skies are incredible, lots of local castles, lots of fantastic coastlines, lots of historic sites in Ireland. As you know, there are features and developments in Ireland that predate the Egyptian pyramids, and well worthwhile historic places to visit. So we'll be running dentistry courses in Skull in Ireland. I will be giving you my email. In fact, here is the lecture room. This is the view from the lecture room you'll be using for the dentistry courses in Skull. So you can see the palm trees actually growing in the garden, which very much reflects the Gulf Stream that comes in and the warm temperatures, and beautiful, stunning plants and flowers all around the area. And for those who enjoy sailing and water sports, it is incredible. Everyone attending the courses will be given a free copy of this Quintessence book on Ozone, the Revolution in Dentistry. And this is my email address for those who would like to attend these courses in Skull in West Cork, not just on ozone, but on lots of aspects of adhesive dentistry and other minimally invasive approaches to dentistry. And I'm also presenting a course with Professor Ray Bertolotti and Professor Jeff Knight in Yosemite. I believe it's the very end of October. So those who might want to go to Yosemite National Park near San Francisco in the USA, once again, send me an email and I'll be more than happy to forward that to Professor Ray Bertolotti to attend that course. I would very much like to thank you for your attention. I'm sure you'll enjoy your water sports here in Skull, and I hope you will enjoy this area as much as I am enjoying it. I really appreciate your time, and thank you very much for listening.
Thank you, Dr. Lynch. What an amazing presentation. Man, oh man. So, Doc, a couple of questions for you before we let you go. Tell me about the ozone. How do you know, although you have shown some research that has been published, how do you know that you have gotten all of the caries?
How do you know you've killed the microorganisms is probably what you're asking, in the caries?
Yes.
That's an excellent question, and it's very important that I should have mentioned that I didn't, so I'm glad you brought this up. In the study, you will notice I said remove all caries except the leathery caries. And leathery caries you can tell because when you stick a probe into that caries with periodontal probing pressure, it will always be sticky, resistance to withdrawal, tacky, leathery. That means you've got about 1 millimeter of caries remaining. All the studies show when you use the Helizone on 1 millimeter of caries, you are killing 99% of the microorganisms within that lesion. If, however, you left all the soft caries and it was 5 millimeters deep, it will not kill the organisms to 5 millimeters deep, and the organisms will simply grow back again. So the point you're making is very important. I'm glad you did, because I forgot to mention it. If you're in any doubt, remove a little more caries, because we know it will have no trouble dealing with 1 millimeter of caries. And when you're dealing with thousands of parts per million of ozone, this will kill those organisms. The study was 10 seconds, but it will do that in even less, and especially the device we use, which is the X4, which can deliver 4 times the dose of ozone. it can produce over 9,000 parts per million of ozone at a high flow rate. And there are studies in the literature that shows 10 parts per million can almost disinfect.
So basically, in dental school, the old conventional way, they would tell us to take a spoon and take that leathery layer out. And believe it or not, I still have a lot of spoons around here somewhere, and I bring them out from time to time. But what you're saying makes a lot of sense. Remove the soft material and go after the leathery layer. Now, you hit a very, very big chord with all of us. Most of us dentists realize that regenerative dentistry, as well as minimally invasive procedures, are simply the future of dentistry because the patients demand it. Would you agree with that?
Absolutely. And it's the old traditional methods, many of them non-evidence-based. I'm a firm believer that whatever we present, we have to have the scientific evidence. We have to have the randomized, controlled, double-blind clinical trials like the one you've just seen today that go through, independently appraise the data, analyze the data, and look for significant, statistically significant differences. And the fact that when we do those biomimetic approaches, and there are many others within dentistry, which are highly significantly better than the more traditional old-fashioned methods, which used to be taught in dental schools and unfortunately sometimes still are.
That is wonderful. Evidence-based dentistry. So you always have the dilemma about evidence-based dentistry versus the research to support and back it up. What do you say to those individuals that come up with new technologies and techniques, but that are better than what the conventional dental schools teach us, versus the generations that want to see 20, 30, 40 years of research?
There are new techniques available now which have very good data supporting them, that are very better for patients. And at the end of the day, that's what we're here for. We're here to present the best possible care for our patients. We're here to do everything that's in the best interests of our patients. And what we always need to do is look for techniques that are available. Obviously, the Ozone is around now for almost 20 years. So there's masses of studies and research carried out with that technique, and there's long-term data available. But as you're referring to maybe newer techniques that are coming now, yes, but these newer techniques, there are newer ones available which have got good data to support them.
I see.
So always look for good evidence-based techniques.
From your clinical experience and your teaching experiences and all of the interactions you've had with this particular technique, what would you say the number of cases would be on a 1 to 100 scale or percentage of the cases that you do the procedure and they still turn into irreversible pulpitis type situations?
Again, as an academic, I would want to have seen a study on that. But from anecdotal evidence, what we clearly know and what we see from this particular study is that it's significantly better to do this technique of being conservative, leaving some leathery caries behind, disinfecting it, then using a biomimetic material to actually let the tooth heal and being more conservative. That also leaves the cavity smaller, and all the composite resins we're using shrink. So therefore, if the cavity is smaller, there's less shrinkage, less volumetric shrinkage. Associated with that less volumetric shrinkage is is less marginal leakage, less staining at margins, less post-operative sensitivity, and everything that factors towards a more successful, long-lasting restoration for the patient.
Excellent. Here comes an important question. What is the temperature at 3:31 in your beautiful countryside you're sitting at right now?
I think outside, if we have a little look, I'll let you judge yourself. I don't know if you can see out there.
It's beautiful. I mean, this is of course,
I would guess, I would say about 25.
25, very nice. I grew up in Europe, Germany, and brings back a lot of memories, those countrysides. And I think that our colleagues to come to visit you for your courses would have not only a wonderful educational experience, a tremendous social experience, one for the memories. But Dr. Lynch, we're forever grateful for your time. I know you're a very busy individual, that you have allocated and donated the time to come and contribute to this peer-to-peer project. And we look forward to having more lectures with you. And I'm going to have to start looking for that course link, because that sounds pretty exciting in Ireland.
Well, I'm afraid I've already seen about 6 emails have already popped in saying, please, can they have a place on the courses? So the emails are already coming. I think Skull in West Cork in Ireland is going to have lots of dentists attending. Of course, it's not going to be all work. They'll only have to work 8 or 10 hours every day, but the rest of the time it can be fun.
Yes, dentists are into everything and are everywhere. So we shall see you in Ireland. And thank you so much for your time again, Dr. Lynch, and your friend.
The fresh fish here, by the way, is just unbelievable. To get the mussels or the crab from the fisherman, and now just eating it afterwards on a different taste. And no pollution. There are no, the only industry Skull has is fishing. There's no pollution. The air, as you can see outside, stunning.
One final question: how did you guys do with the COVID in that region?
I think the entire area of Skull, I think there was 1 case. People here are very careful. It's very hygienic. They've done extremely well.
All the right bells and whistles to get some education and have some fun with Dr. Lynch. Decades and decades of experience and contribution to the profession of dentistry. Thank you so much, Dr. Lynch, and I wish you a wonderful remainder of the day where you are. And we look forward to seeing you soon, and hopefully you can join us for the festivities on Sunday, where we are going to be playing certain videos from 8 to 5 and other surprises to come for this monumental event that we put together with 150 doctors. More than 150 peers and dentists and medical doctors and what have you. So thank you so much, Dr. Lynch, and take care.
And I would like to say thank you ever so much to you, Keanor, for organizing this. And how many people have you actually reached?
As of last night, we were over 2,028,000. So we broke that barrier and the mark last night. It was a very, very magical thing that happened between Mother's Day, and then we had Dr. Christensen on the day where we surpassed 1 million. And then we had the big Dr. Lynch on the day on the final day, as well as the night before, to reach to cross the 2 million mark. So amazing things happening. One for the history books, but it's a sample, an example of what we all can achieve together.
It's a credit to you to reach over 2 million people. Congratulations to you. And thank you very much for all the audience for tuning in.
Thanks so much, Doctor. Have a nice day. Bye-bye.
My pleasure.